Hi, I'm Dr Anthea Rhodes, paediatrician here at the Royal Children's Hospital in Melbourne and your host today of the Kids Health Info podcast. Well, spring is here and that means it's thunderstorm asthma season. At the moment on the podcast, we're chatting to some of our expert doctors from downstairs in the emergency department, and thunderstorm asthma is one of those things that sometimes brings kids into our ED. So to tell us a bit more about what it is, what to look out for, and what to do if it's happening to your child, today I'm joined by one of our emergency physicians, Dr Tristan Harding. Hi Tristan.
Hi Anthea, thanks for having me.
From the Royal Children's Hospital Melbourne, this is the Kids Health Info podcast.
So thunderstorm asthma, I feel like we hear about it all the time, but is it really a new concept or has it been around a while?
Thunderstorm asthma has been around for quite a while, but it's one of those rare episodes or things we don't see very commonly. There's actually been less than 10 episodes seen in Victoria ever.
So Tristan, you've mentioned the word episode, a thunderstorm asthma episode a lot. What do you mean by that?
So with a thunderstorm asthma episode, we get a lot of people becoming unwell at the same time due to a combination of high pollen levels and a change in the weather.
So that episode is like the event where multiple people have experienced thunderstorm asthma.
Correct.
So what actually happens when someone experiences thunderstorm asthma?
So thunderstorm asthma is a phenomenon where children or adults can have sudden onset difficulty breathing, and it's caused by a sudden change in the weather, a certain type of thunderstorm that sweeps pollen up into the air, breaks it down into tiny little particles, which we then breathe in, and they attack our airway. It can happen to children who are susceptible to asthma and to those who have hay fever, but it can actually occur to anyone at any time.
Okay, so if children or adults have a history of hay fever or asthma, they're more likely to experience this, but anyone can get it.
Correct, yeah.
So something parents sometimes ask me, Tristan, is, well, what's the difference between thunderstorm asthma and regular asthma?
It's a great question, and asthma can be triggered by lots of things. Most commonly we see it triggered by viral infections, but it can be triggered by smoke or pollen or sometimes even by pet or animal hair. What we do find though with thunderstorm asthma is that we get lots of people having the same symptoms on the same day, usually triggered by high pollen levels and often gusty winds because that pollen then gets breathed into your airways and causes asthma symptoms or an asthma attack.
And so do we treat it the same way as regular asthma or is it different?
So we do treat it the same way. We still use our blue puffer with our spacer and mask if we need it. We also find though with thunderstorm asthma, we can use antihistamines to help treat the allergic response.
So what can parents look out for if perhaps thunderstorm asthma might be happening to their child? What are the signs?
The things we tell parents to watch out for is mostly to do with their breathing. So if a child suddenly develops shortness of breath or they're finding it really hard to catch a breath, we see them going blue around their lips or having frequent coughing episodes. They're things that they should watch out for, and if they occur, seek medical attention, be that your local emergency department or calling an ambulance if you're really worried.
And what is it exactly that would be a situation where you should call an ambulance or come to the ED with thunderstorm asthma?
The kind of things you worry about is children who have persistent coughing fits that won't break, children who become intensely itchy, or children who might be really, really struggling to catch a breath to the point of going a bit blue around their lips. In that situation, you should definitely go to your local emergency department or call an ambulance. And there's lots of treatments we can use to try and help with a thunderstorm asthma event.
And for parents at home, perhaps if it's not as severe or while they're waiting for that emergency help or care to arrive, is there anything that they can do at home for treatment?
If a child has a known history of asthma, trying their asthma medication, so normally their blue puffer, and if they're young, using it through a spacer and a mask to make sure we're getting as much as we can into the lungs. For children who have lots of allergies, trying an antihistamine is probably the best way to make sure we're not just treating but also preventing the risk of it occurring as well.
Okay, and so with antihistamines for children, what sort of formulation might that be? So as adults, a lot of us might be popping antihistamine tablets of some sort with spring around. What about for kids?
There's lots of commercially available syrups or liquids for antihistamines. All of them are very safe. They're all non-drowsy formulations, and the dosing is very straightforward as per the instructions on the box or the bottle. So I'd recommend having some at home at this time of the year for anyone who's susceptible or they've got a family history of allergies, because they're very safe medications which can be given in that situation.
Okay, great. So if you know your child's at risk of hay fever or asthma, having an action plan and having those particular treatments and medicines ready to go and using them if you've got signs of thunderstorm asthma coming on.
Yeah, they're both very safe, so definitely recommend that.
What about prevention?
So prevention, I guess, comes down to our two main risk groups. So children who have a known history of asthma and those who have a known history of allergies. And a lot of it can apply to anyone, even if you don't have those. We're now very good at forecasting thunderstorm asthma events because of high pollen counts and changes in the weather. So anyone on those days, I'd recommend having antihistamines in the morning the day of, if you would normally do that.
Even if you don't have symptoms happening, just as a prevention, is that right?
Particularly if you are susceptible to getting hay fever or those kind of symptoms where you get itchy or sneezing that time of the year, having antihistamines on the day of a warning event would be certainly helpful. But also carrying any medications with you. So if you have a history of asthma, making sure you carry your blue puffer with you and your spacer and mask if you use those to get the Ventolin in or the medication in, but also carrying antihistamines on as well.
And so for young children, that also might involve obviously a parent having those things handy or having them at kindergarten, childcare or school in a kit and an action plan ready to go.
Yeah, exactly.
So you mentioned high pollen days. How can parents get warning or notices about those high pollen days, and what can they do other than having the medicines ready?
So a lot of these are now broadcast through early warning systems, through the media and through the Bureau of Meteorology. A lot of the pollen forecasts you can see in the weather every day, but equally making sure that if it is a high-risk day, that we're taking precautions where possible to keep children either indoors, making sure they're not outside at the time of weather events, like when the wind is picking up or when the storms are on their way, and making sure that they have had their medications in anticipation.
Yeah, great. And we'll put some links actually in our show notes and the Kids Health Info fact sheet to help parents find a way to actually keep track of those pollen warnings, because they are, as you say, frequently now broadcast, and sometimes even in the news you'll see a heads up that those sorts of things are ahead, especially here in Melbourne.
And I will just reiterate that these are rare events. There have been less than 10 in Victoria that we've ever recorded. So whilst we don't expect them, we do want parents to be prepared in case one was to happen again.
Thanks so much, Tristan. Lots of really practical advice there, reassuring things for parents to know what they can do, what to look out for. And as you say, in the end, fortunately, these things are rare, but important to know and be ready just in case one of those things happens and it's one of your kids who's unwell.
Indeed.
Thanks again for joining us.
Thanks, Anthea.
Information in this podcast is general in nature and is intended to support, not replace, discussions with your doctor or healthcare professional. If you have concerns about your child, please consult your local healthcare professional for individual advice. This podcast is recorded on the traditional lands of the Wurundjeri people of the Kulin Nation, and we pay respects to their elders. Kids Health Info is funded thanks to the support of the Royal Children's Hospital Good Friday Appeal.